Hello, everyone. Good morning and good afternoon from wherever you are. We are so glad you can be here with us again, discussing healthy aging. I hope you have been watching our videos and that you have been commenting, liking, or even sharing some concerns or questions that you have that you would like us to tackle. Thank you once again for joining. And today, we once again tackle a very interesting concept. It is an issue that affects very many women. And today we are going to learn the ways in which we can identify it when it comes, and the different ways in which you can manage the condition when it happens. We'll start by sharing a story. And so Mwajuma is a 52-year-old lady, very excited because her career is cruising. She's doing very well. Her children have just left her home. And we get very excited when children do well and they're able to move out and become independent. And so she's looking forward to enjoying her time, and enjoying the empty house and the empty nest. And she's looking forward to starting new activities and new hobbies like pottery and singing. However, her health is not as good as it used to be. She has noticed that her periods are becoming irregular. She has also noticed that she's getting a lot of fatigue, associated discomfort, especially during the day. But most of all is that she's been having hot flashes where she really gets very hot and flushed to an extent where she sweats. And those hot flashes are actually waking her up at night. And because of the constant disturbance of her sleep pattern, she's moody and anxious, and she's not very well rested. And so it's giving her a hard time, and she wants to go to talk to her doctor. Are you able to guess what I'm talking about? You're right, menopause. And so today we are discussing menopause and the different concepts and elements associated with it. And so menopause is a phase of life. It's a normal thing that happens to all women, especially as we age, usually taking place to women who are aged between the years of 45 to 55. And because it's not a one-time event, it's a transitionary phase of life. It can take from up to 7 years to 14 years for a woman to fully transition. And what happens when we get to the years of 45 to 55? First of all, we age, we become wiser, we become wiser and more knowledgeable. In our careers, I'm sure we have grown and we've reached the epitome or are nearly reaching the epitome of where we want to reach. At home, our children are leaving the home. And so we are having a bit of an empty nest. Our relationships with our spouses are also taking off because now we'll have more time to spend with each other, to connect and to be more intimate. And all these changes are going on. Remember, we still have our parents that we are taking care of, and our parents are aging. So it's a mixture of good things and bad things where we are letting go of our young ones, but we are caring for our older parents. In between all these changes, the body is also changing. And so menopause in essence is just a transition in terms as regards our fertility rates. And so when we are young and energetic, we have a lot of hormones in our system, that the hormones that essentially make us female, which is estrogen and progesterone. Of course, we have many more other hormones, but when we're discussing menopause, we are really talking about these two hormones. And so when we get to the ages of 45 to 55, what we notice is that the levels of estrogen start dropping. And the drop is not drastic, it's very transitional. And so as women, we also have transitional signs and symptoms that start appearing in our body. And what are some of these things that happen? Number one is that our periods start becoming irregular. For example, if they used to come every day, every month on the 28th, sometimes they come on the 30th, sometimes they come on the 22nd, sometimes they don't even come at all, right? Sometimes you have a full period where you have normal flow, sometimes you have spotting, sometimes you have very heavy flow. And all these changes should be able to let us know that we are in the perimenopausal transition. That should guide us to understand that we are now onto the path of menopause, right? And so the period of menopause will usually be confirmed 12 months after a woman's last period. And so for all women out there, if your period has been missing for the past 12 months, it is perhaps possible that you have gotten into your menopausal stage. Yeah. And so the duration of the transition can be very long, depending on how healthy you are, whether you're obese, whether you're smoking, whether you're taking stimulants like alcohol and spicy foods, whether you're on any medication. And so all these things will affect how long your transition will be. But in essence, the menopausal transitional phase can last from between 7 to 14 years. And so what are the other symptoms that we might be looking at? Number one, we have spoken about irregular periods. Number two, we talk about mood changes. Yeah. They become very moody and anxious and very easily irritable. But worst of all is that they can also become depressed. And so even as family members, we need to be watching our mothers and our aunties who are in that age bracket, 45 to 55, because it's very, very easy for them to lapse into depression. And if it is uncatched or it is not managed in a good time, then we shall be having a lot of health issues with this population. We have spoken about the hot flashes where they start sweating and feeling hot, even though the environment around them is normal temperature. We've spoken about the hormonal changes that then cause very many changes in the body. One of which is that it changes the sexual organs, right? And even for the vaginal area, we start seeing a bit of dryness and loss of vaginal fat, which then means that they start having pain or discomfort during sex, which then affects how intimate or close they can be with their spouses. So you can see that there are so many changes that are happening, okay? And so this menopausal transition phase is normal for everyone, and it is affected by how healthy you are. For example, if you exercise and you eat well and you're well hydrated and you've been taking your supplements when and if you should, then the transition is a bit more smoother than someone who has been taking stimulants like coffee or alcohol or even spicy foods. The transition is smoother than someone who has been undergoing chemotherapy. We do know that patients who go through chemotherapy have a quicker transition into menopause. And so you might be younger in age, but because you had your chemotherapeutic drugs, then you transition into menopause at a faster phase. So we advise women that if you think you're in this perimenopausal transitional phase, please go to your doctor, have your hormones checked. They'll check your estrogen levels, they'll check your follicle stimulating hormone levels, and they'll be able to just make sure that everything is in order, even as they keep monitoring you. Okay? So we'll very quickly run through the signs of menopause, the different signs, as we dig in a more in-depth manner into them so that we understand what each of them entails. And so the first one is change in your period. And we have spoken about this. Your periods become irregular, or they become very heavy, or they become very light, or you even have spotting all the time. This is one of the first indicators that should guide you and tell you that you're actually getting into the perimenopausal transitional phase. The second one that happens is hot flashes. And this I have experienced and I have seen my friends go through it. And so we are seated in a meeting and everyone else is having high-level discussions. And you find a woman starts sweating, and it's usually sweating from the upper body. And they're sweating and the sweat is dripping down their faces. They become flushed. And if they have very light skin, then you see the flushing of the skin. And this takes place, and this can go on for a period of 30 seconds to even 10 minutes. So you can imagine you're even chairing a meeting, or you're in a high-level meeting, and then you start getting uncomfortable like that. It can be quite disorienting. And this can happen once a day to even multiple times a day, depending again on your health status. And so hot flashes can be quite disheartening and disorienting, especially when they happen when you're in a formal setting. So after the hot flashes, you find that the lady has a lot of sweat. There's a lot of sweating associated with it. And so ultimately they have wet clothes at the end of the hot flash section occurrence. And so hot flashes are really, of course, we've said they're normal occurrences, but they really disorient the women, especially when they go on in the formal setting. The other one that we need to talk about is bladder control. Remember, we have said that estrogen is very key to the health of the women's sexual organs, right? And so when you have a decline in the level of estrogen in the body, then you have a weakening of the female sexual organs. And so what happens is that the uterus and the vaginal muscles become they're not as strong as they used to be. And so this can affect even the ability to be continent. And so we start having issues with incontinence associated with bladder control. And so this sudden urge to urinate or the leakage that happens when you sneeze, when you cough, or when you laugh is associated with the reduction in the estrogen hormone associated with this midlife season. Next, we talk about sleep. We have said that menopause increases your chances of hot flashes. And these hot flashes can also take place at night. And when they take place at night, they're called night sweats. And we had an issue of a chicken and the egg. And we were asking, do night sweats disrupt the sleep, or does the sleep disruption, is it associated with night sweats? We were not very sure which one is which, but what we have realized after going through a number of studies is that night sweats happen at night, and because they are so severe, they can actually wake you up. And when they wake you up, it means you have disrupted sleep, you're not well rested, you're disoriented, you have memory fog, and you're not able to think straight. And so this lack of sleep is an issue that really affects our menopausal women, yeah? The other issues associated with menopause is, of course, what we have spoken about, vaginal health and sexuality. Because of the reduction in the estrogen hormonal levels, the vagina becomes dry. And remember, we need lubrication, especially when you're having sexual activity. So when you have a dry vagina, then it means sex becomes uncomfortable and even painful, which is a condition which we call dyspareunia, right? And so you find that women in this age group, they get disinterested with sex. Or anytime there's an opportunity to indulge in sex, they shy away from it because of the associated discomfort that they feel. This is misnomer, considering that at this age, you should be more confident in the bedroom because you're sure you won't get pregnant, and you're more confident in yourself. However, because of these hormonal changes, it affects how the women view themselves and how willing they are to engage sexually. The other thing to consider is that as the vagina becomes dry, it becomes prone to tearing. And anytime there is tearing, it's very easy for someone to get infected with some of these sexually transmitted infections that we know, top of which is HIV, AIDS, of course, and herpes, and so on. And so it's advisable for women, if they can feel that their sexual area is becoming a bit dry, they use moisturizers or lubricants which can be bought over the counter, or they even use condoms so that they stay protected and healthy even within the sexual interactions that they shall be having. Next, we talk about mood changes, and we have said that ladies in this age group, 1 minute they're very happy, and then the next minute when they're having a mood swing or a hot flash, they get very irritable and they become disoriented. And this is a normal process because of the changing hormonal profiles, and they can even fall into depression. And us as the family members and as friends, it's imperative and very important that we are able to monitor and catch that depression in good time to prevent further progression. It's also good to know that part of the menopausal changes that happen is that the body changes. The skin becomes thinner. You notice that when you were younger, your skin was nice and thick and supple and very well oiled. As you're growing older, your skin becomes very dry. Your hair becomes very thin and very, very fragile, right? It's not as strong as it used to be. You lose fat. And so you find that it's very hard to find a grandmother who is chubby. You notice that the older they become smaller and smaller. That's because the reduction in the hormone estrogen causes them to lose fat, and so they become smaller and more frail. And that's why we keep saying that it's very important that as we age, we keep lifting weights. And in the lifting weights and staying active in the gym, we are able to maintain our muscle mass so that we don't become very small and frail as we age, right? So some of the changes associated with menopause might be memory changes and joint pains, on and on and on. I know I've introduced the concept of joint pains, and that's because estrogen is very important for the maintenance of bone health in the body. And so anytime women are getting into the menopausal phase and the estrogen levels go down, we start seeing a lot of bone density loss that is happening in the women. And this is a condition that we call osteoporosis. And so the bones become soft and fragile. And I have seen stories of women saying that they were walking from room A to room B, and it's a walk that they have done for all their lives. They were not even running. It was a very normal occurrence. And then they lose control, and then they fall. And because the bones are so soft, it's very easy for these women to get fractures. And so they get fractures from very mundane activities. They can tell you that they were seated, and then they stood up, and then they lost balance, and they fell on the floor, right? They didn't even fall from a height, and they'll tell you that they have broken a bone. And this is very important because as women age, then the bones become brittle and fragile. And so it's very important for family members and friends to be very aware of this, so that for this demographic of women, we are able to supplement them and give them vitamin D supplements and calcium supplements to be able to keep their bones healthy and strong. And the next thing we want to talk about is, now, if a woman is having all these symptoms, how do you treat it? And I think that's a very genuine question. Remember, we have said that this is a normal occurrence, meaning that it's a normal physiological process that takes place to all women. It's only a matter of time before all of us are able to go through all these symptoms. So how do we manage it? There have been studies that have shown that through our diet, we can eat healthy, of course, but then that we can choose foods that are rich in estrogen, some of which have been said to be, soya or soybeans. There have been discussions around sweet potato having high levels of estrogen. But the problem with this is, of course, we are not very sure of the dosage, okay? And so we don't know the dose that you will take that will be sufficient to supplement the deficit that you're having. And so what we are saying is that anytime you think you're having a reduction in the estrogen levels and your periods are starting to become irregular and you're starting to see hot flashes, please get in touch with your doctor. Your doctor will be able to test your hormone levels, and this will guide how we will be able to supplement or replace them. So I've brought in the element of supplementation, where I'm saying, yes, you can make sure that your diet is on point and you're eating the right things at the right time. You're eating your fruits and vegetables so that your vitamins and minerals and water and all those things are optimized. But we're also saying that you can also go to the doctor and get tablets. And we have something called hormonal replacement therapy. And it's a form of replacement program where we try and give you estrogen, medication that is rich in estrogen, to try and supplement what is being lost or reduced so that we reduce the amount of symptoms that we are having. Remember, we have said these symptoms can be very debilitating. And so for the people who have very severe forms of perimenopausal transitional symptoms, we give them hormonal replacement therapy for a period of time. And so they use it periodically, after which we withdraw them. Why are we withdrawing them? Because prolonged use of these estrogen supplements again has side effects, very adverse side effects. They have been known to increase the risk of heart disease. They've been known to increase the risk of bone density reduction, which again is diabolical. But most of all is that they can also increase the risk of some of these cancers that women face. For example, breast cancer, ovarian cancer. And so what we are saying is that this hormonal replacement therapy should be done in a phased manner so that it does exactly what it's supposed to do. And then the doctor is able to withdraw these drugs in good time so that again, you don't end up getting the adverse side effects, which can cause you further trouble. So what we are saying is that menopause is a normal thing. It will affect all of us. And as we have seen, it comes with so many signs and symptoms, some of which can be mild, some can be moderate, and there are some of us who will have very severe symptoms that can affect our quality of life. If you think that the changes are too extreme for you, please get in touch with your doctor so that they're able to monitor your levels and they're able to supplement it in a prudent manner, and they're able to give you medication which can then reduce some of these symptoms that you'll be facing. We look forward to receiving your questions and comments and concerns. Please leave them down below. If you want us to bring in some more people to talk to us about this topic, we shall be able to do that so that we get stories from the field and stories from other women as to how they're handling this very delicate phase of life. We shall also be sure to talk about andropause, which is the male process of menopause, for lack of a better term, so that we also advise our men on how they can stay healthy and be healthy even as we continue aging in a healthy manner. Thank you for joining us. We are glad you could be here with us, and we hope to see you next time.